want to welcome everybody. Excuse me, and thank you for carving out some time today to discuss a really important piece of the 340B puzzle. Excuse me, I have some in my throat. All right, if I make it through the presentation, again, thank you for everybody for joining, and thank you for those who are listening and indulging in the very short version of Sports Center we had where we were talking about the Celtics championship. But a couple of housekeeping items before we get started. Your mics and cameras will be off during the presentation and the webinar. So you have our permission to multitask, as we like to say. After we're through with the presentation, there'll be a Q&A at the end. You'll be able to enter questions in the chat window. You'll see it's a Q&A button on the menu bar. Thirdly, we're recording today's presentation, so if you're inclined later to forward it to associates or listen again, we'll be sharing copies. And at the end as well, we will have contact information for all of the speakers. But thank you all for joining us. This is the first in a series of webinars. The title for this originally was Clearinghouse Ready. And we originally thought of that to get people to start thinking about how they can be ready, especially CEs, in addition to their partners, TPAs, audit firms, anybody else in the ecosystem. But we really decided upon having this be more conversational around the legislative components, where really the start of a clearinghouse is really forming. So that's why we have it as inevitability, and then sustainability, because we really believe it's important for the 340B program to have transparency and balance. So that's the focus of today's conversation. So here's our agenda. I will do a very quick welcome. We'll talk a little bit about our RxParadigm, and Tim Nealon, our COO, will also be giving some opening remarks. Then we'll throw it over to Bill Von Ocean. Many of you might know Bill from his work at Powers. He'll talk about the legislative components and what's happening in DC. And then we will talk about a clearinghouse as part of the 340B solution. So I'll be addressing that, and then we'll do our Q&A at the end. Again, so just a little bit about Bill. Bill's a principal at Powers Law Firm. Everybody might know Powers. They've been around since 1983. Powers is one of the preeminent law firms in the country, really focused on healthcare. I think they work with hospitals, multi-hospital physician groups, home health agencies, covered entities of all types. They really specialize, I believe, in tackling very complex issues in healthcare, of which I all think we can agree the 340B program falls in that bucket. On Bill's team, I don't know if they're listening or not here, but you may recognize a number of them from the conferences: Peggy, Jason, Mark, Bill, and I'm probably leaving out a couple that are also on the team who helped do this great work. But everybody is mostly familiar with Powers, so I thought I'd give them that 30-second commercial. Bill, feel free to fill in any gaps I may have left. Again, I'll be speaking as well, and Tim Nealon, our COO. So I'm going to throw it over to Tim for a minute.
Yeah, I'll be brief. Thank you, Carlo. Appreciate it. Good afternoon, everybody. As Carlo mentioned, I am Tim Nealon. I'm the COO of RxParadigm, and I'm very delighted to welcome you to our opening webinar, the first of many, where we'll be focusing on the pivotal issues within the 340B program. So thank you very much for joining. As many of you know, the 340B drug discount program stands as one of the largest government initiatives funded by pharma, but it's aimed at providing crucial support to Indigenous and disadvantaged Americans. And since its expansion under the ACA, there's been a lot of debate intensifying over the last few years over the optimal use of program resources. So later in our session, Bill and Carlo will talk about and explore proposed legislation aimed at sustainable solutions, and they'll be emphasizing market-driven strategies to recalibrate the program's trajectory. Now, it's critical and imperative that there's effective collaboration among the stakeholders, and that ensures continued growth and effective service delivery of the 340B program. We at RxParadigm, we champion market-driven solutions, including the 340B program, and we strongly believe that these yield the best results. One of the key challenges facing the program is the issue of double dipping, which is believed to have exceeded $10 billion with a B in 2023. And this impacts both Medicaid, it impacts Medicare, and commercial payers alike, compromising program integrity, but without benefiting participating entities. We at RxParadigm, we address these challenges through our clearinghouse, which leverages proprietary technology to safeguard data privacy and security, and it aligns with the program's foundational goals. So we at RxParadigm, we're steadfast in our commitment to resolving these issues and fostering ongoing collaboration with all the stakeholders. So I want to thank you again for joining us today, and we very much eagerly anticipate your continued engagement in tackling these critical challenges. So thank you very much, and Carlo, I'll pass it back to you.
Yeah, thanks, Tim. Tim stole most of my thunder, but I'll continue on anyways. Nice job, Tim. Thank you. In just sharing a little bit about our company. Again, a lot of people might be familiar with Powers, maybe not as much so with RxParadigm. Really, we are a technology solutions provider in the drug supply chain space is how we look at it. We really like to think of ourselves as the peacemakers in this kind of I don't want to use the word war, but challenging environment. We really think of ourselves as Switzerland. What we are not is a TPA. We are not a consulting firm. We are not associated with any stakeholders in the 340B ecosystem. We are really an independent, agnostic technology solution looking to provide a more transparent and balanced approach to the 340B program. So that's us in a nutshell. We were founded by two gentlemen, Messin Tenganu and Chris Chan. Messin has spent the last 20 plus years working in and around the mid-Atlantic part of the country, building one of the largest PBMs in that area. He and Chris, his partner, Chris is our chief clinical officer and pharmacy officer at RxParadigm, has spent a lot of time in managed Medicaid and Medicare plans. So between the two of them, they kind of peered around the corner a number of years ago and saw this challenge that existed with duplicate discount and built our solution, Tungsten Plus, which is the name of our clearinghouse, the product name, to address this solution well before people were talking about it. So they really peering around the corner and really visionary in that regard. But they were upset with the status quo and felt like, hey, double dipping or duplicate discount can and should be addressed. So those are our founders. That's us in a nutshell. I'm going to throw it over to Bill. Bill, would you like me to read the disclaimer or should you read the disclaimer officially? Because anytime we have an attorney, we should have someone read the disclaimer.
Yeah, well, I think actually that our audience can probably read it for themselves, but I did want to make the point that we only represent really pro 340B clients. So that would include the hospitals and clinics participating in the 340B program, associations representing covered entities, 340B service providers like third-party administrators and contract pharmacies. We don't represent the pharmaceutical industry. We don't represent payers. In some ways, we're fighting a war on two fronts, one with manufacturers on one side and one with payers on the other. But I think the reason that we were engaged, that Powers was engaged by RxParadigm, is because of our very visible role in advocating on behalf of the interests of covered entities, because it is critical that covered entities support this idea of establishing a clearinghouse. And Carla, maybe you can go to the next slide.
Yeah.
I think broadly speaking, a clearinghouse, at least for purposes of this presentation, is really any arrangement or mechanism that is designed to protect against duplicate discounts. But we have to acknowledge up front that there can be a disagreement over what is a duplicate discount or double dipping, as Tim said. And I think that the covered entity community views the duplicate discount problem as really being limited to Medicaid, because in the Medicaid 340B arena, manufacturers are obligated to provide discounts and rebates in two different programs that overlap. And so from a strictly legal standpoint, manufacturers could very well be asked to give both a Medicaid rebate and a 340B discount on the same drug. But when we talk about duplicate discounts for commercial claims, those duplicate discounts don't arise because of the interaction or overlap of two federal laws. There, it's really the interaction between one federal law, 340B law, and private contractual arrangements, because the rebates that manufacturers pay to payers are commercial rebates. They're privately negotiated. And I think there's a tendency among covered entities, and I have to say that this is true of me for a long time until relatively recently, that, that's not really a covered entity problem. If the manufacturers really want to solve and payers really want to solve this duplicate discount problem involving commercial claims, they could just stop entering into these rebate arrangements and it's done, right? We don't have to enact legislation. We don't need a regulation from the federal government. It can be done in the private market. But I have to say, I do think that that is a somewhat naive perspective. And I say that because we are up in Congress almost every day, my colleague Peggy Tai in particular, defending the 340B program. You're probably all aware that pharma is on a campaign to reform 340B. And I think payers are also trying to reform 340B. And a large part of that is being driven by this duplicate discount issue involving commercial claims. So I think that if we want to try to protect the 340B program long-term from pretty serious restrictions that are being considered right now by Congress, we need to be part of the solution. And it's a big part of why I'm excited about this engagement with RxParadigm, because I do think they have a solution that covered entities should take very seriously. Anyway, that's I just wanted to make that point up front. I'm going to turn to the slides now and just go back to the beginning. The idea that a clearinghouse could play a role in the 340B program really did not emerge until 10 years ago or so. And it really was in the wake of the passage of the Affordable Care Act. And again, it relates to Medicaid. So I think we need to start at the very beginning, which is the 340B statute enacted in Congress in 1992. And Section A5A of the 340B statute makes very clear that manufacturers are protected from giving both a Medicaid rebate under the Medicaid drug rebate program and a discount under the 340B program on the same drug. And Congress directed the Secretary of Health and Human Services to establish a mechanism to implement this protection against duplicate discounts. And what the Secretary did through HRSA, which is the agency charged with administering the program, is to establish the Medicaid exclusion file. And I think most of you on the line know how the Medicaid exclusion file works, so I'm not going to go through it. But that's the way, up until the Affordable Care Act, that the duplicate discount issue was addressed. Next slide. Well, so let's go to 2010 when the Affordable Care Act was passed. And you all know that the 340B program was expanded under the ACA, but the Medicaid drug rebate program was also expanded under the ACA. Prior to that, manufacturers only had to pay rebates to the Medicaid program on fee-for-service drugs. But under the ACA, it was expanded so that they also had to pay rebates on the managed care drugs. And that, of course, exacerbates the duplicate discount problem, because manufacturers now could be subject to duplicate discounts on Medicaid managed care claims. Luckily, Congress anticipated this problem and included language that amended Section 1927J of the Social Security Act that essentially said that managed care MCO drugs are not rebatable when purchased through the 340B program. Now, that's very different than the way that Congress chose to address the duplicate discount problem in the original statute in 1992. So the 92 statute makes it clear that for fee-for-service drugs, it's the covered entity's responsibility to protect against duplicate discounts. For managed care drugs, it's the state's responsibility. And that's asking a lot of states because, the states are administering their managed care programs through contractors. And so that means they have to include in their MCO contracts language that directs the MCOs to remove 340B claims from their pharmacy claims data so that those claims are not submitted to manufacturers for purposes of requesting rebates. Next slide. So covered entities have generally done a very good job in protecting manufacturers from duplicate discounts. They know how to use the MEF. But the same cannot be said for states. There have been a couple of federal reports that have documented the problem of duplicate discounts for Medicaid managed care claims. And states have tried to shift the responsibility from them onto covered entities. Those efforts have not been successful. And so the reality is we do have a problem with duplicate discounts when it comes to Medicaid managed care. Next slide. Hence the idea of a clearinghouse. To their credit, covered entities have recognized that even though it's a state responsibility to protect manufacturers from Medicaid managed care duplicate discounts, covered entities need to be part of the solution. And so they have really united around this concept of establishing an independent clearinghouse that would receive both claims data from covered entities and Medicaid rebate data from states. And this independent contractor, government contractor, would then exclude 340B claims from the rebate requests sent to manufacturers. And that's sort of the idea that is the underpinning of a piece of legislation known as the PROTECT Act that was introduced by Congresswoman Doris Matsui several years ago, and has been reintroduced several times in Congress. And so this, I think, represents really the way covered entities would like to see a clearinghouse designed. It would be run by a neutral party under contract with HHS. The data submitted to the contractor would be kept confidential. The 340B claims data would not be shared with manufacturers. Rather, the contractor would remove those claims from rebate requests that are given to manufacturers for purposes of requesting rebates. So that is sort of the litmus test of what the covered entity community feels should be a clearinghouse. Next slide. However, that's not the only stakeholder in the 340B program. Manufacturers have a much different concept of what a clearinghouse should look like. And all you have to do is go to the 340B ESP software platform to get an idea of, or to appreciate just how different their approach is to this idea of protecting against duplicate discounts. You're probably aware that the 340B ESP clearinghouse is run by a manufacturer vendor called Second Sight, And it really was marketed to manufacturers not just as a way to avoid duplicate discounts on Medicaid managed care claims, but also TRICARE, Medicare, and commercial claims. And so there we see this idea of a concept, this idea of a clearinghouse being applied more broadly than just Medicaid. And as I said in my initial remarks, covered entities can sort of say, well, that's not our problem. But I do think that if we're looking for the long-term protection of the 340B program, it sort of is our problem, and we need to be part of the solution. Now, I think the 340B ESP model is not the solution. I think we would all agree with that. I mean, covered entities have to agree to these terms of use. Claims data is de-identified, but there's a host of problems that we have all encountered with that program. Next slide. I mean, besides the fact that it's used more broadly than just Medicaid, the terms of use are non-negotiable. They're not transparent. There's no way to really renegotiate the terms. It's a very imbalanced contract or terms of use that you have to enter into, limiting second sites liability and putting all the liability on the covered entity. There's still lingering concerns about HIPAA and state privacy law liability, even though there is this de-identification process. And there's just a concern about the unauthorized use of the data submitted to the platform. Because again, these are manufacturer vendors. This is not a neutral party running this clearinghouse. And so the concern is that this data will be used by manufacturers to withhold rebates to payers, and payers trying to compensate for the loss of those rebates are going to cut reimbursement to covered entities. That's one of the biggest concerns about applying a clearinghouse model to commercial claims. But there's also concerns that manufacturers could use the data for advocacy purposes, again, to reform the program, for marketing purposes, and other things besides duplicate discounts. Next slide. And of course, there's the operational problems with the clearinghouse too. There's not just conceptual problems. There's also operational problems. When you submit the 340B claims data for contract pharmacy claims, you're supposed to regain access to 340B pricing. Well, covered entities have uniformly reported long delays in getting access to 340B prices on contract pharmacy drugs. And sometimes when they do get the pricing, it's interrupted, and they have to troubleshoot with the ESP team to figure out what the problem is. And a lot of manufacturers have adopted policies that require that the claims data be submitted within 45 days of the dispense date. So there's this enormous time pressure on covered entities and their TPAs and pharmacies to submit the data quickly. And manufacturers are slow to resolve these problems. We hear over and over again the problem of delays. And a lot of it is just inherent because there's so many parties involved. You've got not only 340B ESP, but you've got the manufacturer, the wholesaler, the covered entities TPA, you've got the contract pharmacy, and they often have to communicate with each other to resolve some of these problems. Next slide. Well, I think the notion that clearinghouse could be limited to just Medicaid has already been undermined by Congress itself, because Congress created the Inflation Reduction Act 2 years ago, and in there included provisions designed to cut the costs of prescription drugs within the Medicare Part B and Part D programs. And they do this by authorizing the Secretary of HHS to negotiate prices with manufacturers. Those negotiations are designed to reduce the cost of drugs to the maximum fair price, MFP. And it also penalizes manufacturers for increasing the price of drugs faster than the rate of inflation. So there's sort of two areas where Medicare is by law, sort of reducing the cost of drugs. Well, again, we have this potential of a duplicate discount problem because you've got an overlap of Medicare and 340B, both telling manufacturers to reduce the cost of their drugs. So it raises the possibility that a manufacturer would give both a Medicare discount and a 340B discount on the same drug. And this would occur in one of two ways. One is MFP. Manufacturers are going to have to pay rebates to pharmacies to bring the cost of their drugs down to this MFP level, the negotiated maximum fair price. Well, if that pharmacy dispensed a 340B drug, now the manufacturer is paying both an MFP refund and giving a 340B discount on the same drug. And the law makes clear that manufacturers are protected from that risk. The other area of a potential duplicate discount involves inflationary rebates. And again, the law is clear that those inflationary penalties do not apply if a 340B drug is being used. So we have been following CMS implementation of these duplicate discount provisions very carefully. And a guidance just came out very recently that is basically, sort of embracing this clearinghouse model, but in a way that does not comport with the way covered entities would like it to be done. It involves the Medicare transaction facilitator who is collecting Part D claims from pharmacies, but instead of taking the 340B claims out, as would be done under the PROTECT Act, they're just turning that data over to the manufacturer. And then the manufacturers get to protect themselves from duplicate discounts. That's not something that the covered entities would like. And actually, comments are due on July 2nd if anyone on the line would like to submit comments and complain about that. So, so the MTF is sort of a neutral party. They are a government contractor, but the problem is they're turning over claims data to manufacturers. Next slide. So let's just recap. The PROTECT Act I've already talked about. This is really the way that covered entities would like a clearinghouse designed, but I think it also is somewhat naive because it's just limited to Medicaid. The SUSTAIN Act, which has gotten a lot of publicity recently, I think is probably going to be the piece of legislation that is most influential in congressional efforts in the future to make changes to the 340B program, and that's because it's bipartisan. It was prepared by the 340B working group, which is comprised of 3 Republican senators and 3 Democratic senators, all who support the 340B program. And in there is indeed a clearinghouse, but it's, and it is a neutral, it would be a neutral clearinghouse, so that part is good. However, just like under the CMS proposal, claims data would be shared with manufacturers. And so it's problematic in that regard. And it would be applied more broadly than just Medicaid. But again, I think that's something that covered entities should stop objecting to. Next slide. Now, importantly, it would protect against 340B claims identification at the point of sale for most covered entities. Most covered entities can't, and their pharmacies, especially contract pharmacies, can't meet these point of sales claims identification requirements. So being able to do it on a retrospective basis is very important. And grantees and their pharmacies would be protected in that regard, but not hospitals. So again, I think it's another problem with the SUSTAIN Act. And then the last piece of legislation, which I think is less likely to be influential in the future of the 340B program, is the 340B Access Act. It's not bipartisan. It was just introduced by 3 Republican members of the House, supported by the pharmaceutical industry and the National Association of Community Health Centers. And again, claims data would be shared with manufacturers, and all covered entities would be subject to point of sale claims identification requirements. And not only that, but if they fail to meet those requirements, they'd be subject to fines. So no covered entity group except for NAC has really supported the 340B Access Act. So I'm going to turn it over now back to RxParadigm to talk about, again, how to implement a clearinghouse model that is consistent with the interests and needs of the covered entity community, but still solves the problem that payers and manufacturers have complained about.
Yeah, thanks, Bill. Yeah, and I think when we look at in total the program, keeping the legislative component in mind, the program, was under a lot of pressure, right? And it is these duplicate payments that really have increased the pressure and start the pressure. And as Bill mentioned, a lot of it is located in and around the commercial claims. And when we look at the commercial claims issue, I think Tim mentioned it in our opening, it's a $10 billion a year issue in the United States that duplicate payments have been made. So it's got everybody's attention because it's a large number. And we believe that it's these commercial claims and the focus there that has increased the tension or kind of brought the temperature up in the room, as someone likes to say. At one of the we were at the grantee conference, and someone kept saying that the temperature is getting high in the room, and they couldn't be more accurate. And again, I think Tim mentioned it earlier as well. Commercial claim duplicate payments provide zero value to covered entities, but ultimately the negative impacts and effects that we see today in the environment are really driven from that. So, and again, Bill mentioned this, that ESP has been really driven by one stakeholder. Right, that's one of the negative effects. The contract pharmacy restrictions have had a major impact on 340B shared savings for covered entities. Many of them have seen by about a third of their 340B shared savings have maybe evaporated or been tougher to get. One of the negative impacts that we were talking in one of our prep calls, and Bill brought this to light for us, is that when policymakers feel like they have to take action, that makes them feel good, which is great. And I think we want policymakers to understand the program. But if they feel they have to take action and a market-driven solution cannot be implemented, we don't know who's going to win that piece. So collaboration really is important as we go forward. One of the other negative effects, and I've seen this by attending many conferences since 2020, since the restrictions have taken place, the covered entities are taking their eye off the ball. They've had to invest resources, time, and dollars since 2020 to address this issue. And really, their goal and their stated mission is to take care of underserved patients. So there's been some real negative effects, we think, there. And then the last and most important negative effect we've seen, which really indicates to us the need for a clearinghouse, is the increased complexity in the pharmacy programs that we've seen. Pharmacy programs, 340B programs have had to adapt and change maybe their policies or procedures, change how they do things, and really that's impacting their ability to get patients access to medications they need. So the program is under a bunch of pressure. I think Bill talked about what's happening at the federal level in great detail. At the state level, there's been about 23 states that have implemented or introduced legislation to help blunt some of these manufacturer restrictions. And what made us think about internally here at RxParadigm is, what if all 50 states had rewrite or add legislation to address this issue? There's going to be 50 different sets of rules, which would be hard for anybody to manage. The covered entities, the manufacturers, TPAs, anybody in the ecosystem, if we had 50 different sets of rules, would create a lot more complexity and add more pressure to the program. Bill mentioned this one as well, the use of the 20 modifier code. It's inconsistent at best, although pharmacies try to do their best to add it. Some won't. Some pharmacy chains will not add the 20 modifier. And the inconsistency of that has left, again, a question about, is a commercial claim, is a claim a commercial 340B claim? Is it not a commercial 340B claim? And again, this is where the tug of war happens. And then, as Bill mentioned, the Inflation Reduction Act. You're going to have a different kind of duplicate discount going forward, not one with a PBM, but one with the Medicare transaction facilitator, that component. If there's a discount paid there, the manufacturer is not going to want to pay it on the other end. So the program is under a lot of pressure. And this is why we continue to say and see that we think the clearinghouse will benefit all stakeholders. Our vision is to kind of rewrite the book. A friend of mine in the space said, gee, when you talk about duplicate discount and the manufacturer restrictions, you're really opening the book, a 10-chapter book at chapter 5. And I liked his analogy. Our thought is, hey, if we could rewrite the book and start at chapter 1 would have a clearinghouse in it. And that clearinghouse would help all the stakeholders, help the manufacturers avoid duplicate discount, help the covered entities have one source of truth, and the plans and PBMs would also have, Medicare and Medicaid would also have one source of truth for a clearinghouse. So we believe that this is ultimately where the market will take us. We decided to have a little slide here to just talk about the benefits for covered entities, since when we looked at the attendee list, it was majority covered entities. This is just a bullet list we put together of benefits. One of the ones that we like out of the gate in the spirit and idea of collaboration was the first one, really, that covered entities can show legislators and pharma, hey, we've got our processes under control. And we have data to show you that, right? The show me the data, show me the numbers, I think is ultimately where we know that the conversations will head. And if we have data, arguments can be made to support, potentially the removal of the restrictions. We think a clearinghouse will help that argument. We are not naive enough to think that if we have a clearinghouse that out of the gate, the manufacturers would reduce restrictions, but it's a step in the right direction. The other benefit that we really think of when we see a clearinghouse is really as an audit tool. The covered entities will know then that they'll have again, one source of truth, one place where the claims live, that will also add for audit functionality as well. So we thought that was an interesting positive byproduct. At RxParadigm, we have built a clearinghouse already. It's called Tungsten Plus. You can see that's the name of the product. You can see that on our webpage. And Tungsten Plus was built again by our founders, really in the thought that this problem would have to be solved someday, and we're really approaching that day. A lot of folks that we talk to at conferences say it's going to be hard to build a clearinghouse, and we say at RxParadigm, we've already got that box checked, so we're already there. So in summary, before we get to the Q&A, we really say change is coming. It's been happening since 2020, March of 2020. The ground in 340B has really been shifting below everybody's feet. At the state level, you've got a lot of individual legislation that's come out. So all stakeholders have to think about how can we collaborate and change for the better. Duplicate discount has to be addressed. If this is where we have to, if we're opening the book at chapter 5, we all have to go back to chapter 1, because there's the intended beneficiaries of the program are not seeing all the benefits, right? Others in this ecosystem are. So we believe that duplicate discount has to be addressed, again, to lower the temperature in the room. And we are encouraging everybody to start now, as we like to call it, with market-driven solutions, where we all work together to eliminate this problem or reduce it. And really the turbulent nature of 340B climate. I know it's turbulent because my father, who really still doesn't understand what I do, and I've been in 340B since 2016, said, hey, I saw something the other day on the news about this 340B thing. So if he's seeing it at 84 years old, I think there's a and it's hitting the news, I think there's a good case that we really should start to look at it. How we can start and help. If any of the covered entities are on this call, or any members of a PCA, a state hospital association, an ACO, an IPA, any group or coalition that you feel you can organize and get together, we'd love to have a conversation. We are currently in talk with 4 states to talk about a clearinghouse project. But so if it's at the state level or at the group level, we'd be more than happy to talk about it, get involved, share with you how we're doing the work, so that folks can start to say, hey, we've already started to adapt to a clearinghouse by working with one to understand the impact and to show that you've got the duplicate discount issue covered. So that is it for this piece. I think we're onto Q&A. So if you've got any questions, feel free to add them into the Q&A chat. And Sophie will be fielding the questions. Here's Bill's contact, Tim and mine, email and phone. So if anybody would like to get into anything a little more deeply, feel free to reach out to any of us. We'll give a minute for questions.
Yeah, if you have come in, Carlo, into the chat window.
Okay, great.
Already. Yeah.
Sophie, will you? Oh, okay.
Yes, so
yeah, fire away.
there's some questions in the chat window as well as the Q&A. So I'll start with the chat window. So first question is, how do you see addressing disagreements when it comes to duplicate discounts on claims? Would discounts be held or recouped while any discrepancies are investigated, and who would be the arbitrator here?
That's a good one. I'll throw it to Tim and then maybe Bill for guidance on that one.
Yeah, sure. Yeah, I think there's different ways of handling it. I think as we've thought about the problem, one way that we think would be valuable would be as the 340B claims are shared by the CEs and their agents into the clearinghouse, there'd be some initial validation to catch some unintentional mistakes or ones that could be questionable, even before the manufacturer has a chance to interact with them as part of the rebate process. So I think that would be an important part of any clearinghouse, is some kind of initial validation and to work with that CE in good faith to make sure that that 340B claim is actually 340B, essentially. Would you add anything to that, Bill?
Well, it's a really good question. And I think you have to answer it depending upon what claims we're dealing with. If we're dealing with government programs, Medicare, Medicaid, you look at the law, and in general, whoever got the discount first under the law is the one that prevails when there's a disagreement. When there is, in fact, a duplicate discount, who gets the benefit? Well, it's the one who it's the benefit that was established under the earlier law. So what that means is if it's a fee-for-service Medicaid disagreement, the manufacturer gets, the state gets the rebate. If it's a Medicaid managed care duplicate discount, the covered entity gets the 340B discount. With Medicare now, these are recent. So these all 340B precedes these Medicare rebate arrangements. So again, if there's a duplicate discount and a disagreement, the covered entity is the party that gets the benefit of the 340B discount. But for non-governmental duplicate discounts, it's going to be a matter of contract, really. I think between the payer and the manufacturer. And I don't know whether that's something that RxParadigm is going to be able to adjudicate. I think that's going to be between those two parties to figure out. But I think what RxParadigm can do is identify the duplicate discounts, provide the information necessary for them to work it out themselves as to who gets it. And who knows, there may be litigation, there may be breach of contract claims and the like, but at least, and it won't involve covered entities. I guess that's the good news, is if there is a disagreement over who gets the benefit of the discount on the commercial side, it's not going to affect covered entities. It's just going to affect the payers and the manufacturers.
Thanks, Bill. I think just to slide a small RxParadigm commercial in here for everybody, because I know you've been waiting for it. One of the ways we work with a lot of organizations and looking at 340B claims and identifying them, and if they are or they're not 340B or they're rebate eligible. Our system can do many things, but with it, we provide it's not just a reason code, but it's detailed text and reasons why something is or is not eligible. And I think that's a feature of the system and functionality the system has that we understand is fairly unique. It's a unique system because there aren't many clearinghouse systems out there, but in it, we've got kind of a very detailed section with text that talks about it's not just a reason code, but it gets into some detail. So if anybody at any point needs a demo, please reach out. But ultimately, it builds on what Bill's been saying, that if you're going to have a number of parties kind of talk about why a claim, someone should get a claim or not, having more detail and more evidence is being evidence-based is always a lot stronger. So, but thanks, Bill. Sophie, did we get any additional questions?
Yes, we have two more. So how do we merge ESP to this platform? When we have to get the manufacturers to release us from ESP and that mandatory participation to hold our current status?
So I think that's a question based on a future state that's not here yet. My guess, and Bill, weigh in on this one, that if legislation comes down, not that ESP would go away, but participation in ESP might go away for some covered entities. What are your thoughts on that?
Well, yeah, if something like the Sustain Act is enacted by Congress, it's clear that this clearinghouse would be applied to both governmental claims and commercial claims, and so that would really preclude the need for ESP after that, because that would all be encompassed now under the new law. And there would need to be language that I think prohibits manufacturers from using parallel clearinghouse programs when there's a government clearinghouse that's been established for the same purpose. So that, I mean, that's assuming that we get legislation in the future. I think, though, that I mean, RxParadigm can be sort of piloting this clearinghouse just in the private market. And I mean, I don't know if it's possible, gentlemen, but I mean, can you prevail upon the manufacturers to rely on your clearinghouse instead of 340B ESP? Because again, it should achieve the same purpose of protecting them from duplicate discounts, or maybe run them in parallel. Although I worry about covered entities now having to submit data to two sources rather than one. But it just seems to me that maybe we can test this out before we have legislation in a way that would migrate manufacturers away from ESP and start using your platform instead.
Tim.
Yeah, you stole my thunder, Bill. I thank you for doing it, because I agree with you. I think kind of in phases moving towards a clearinghouse model and kind of phasing out the existing models that are out there is an appropriate approach. And over time, we feel confident that manufacturers will also come to that same realization, whether through legislation or through market-driven solutions, that a clearinghouse model is superior and that current models can be decommissioned over time.
And just I'll close on this one point on that. I'll add on to Bill's point. I was at we were at the grantee conference, and there was a group speaking, and the group shared that, hey, there's some legislation. All of the legislation we've talked about today is on the table, but it's 2024. It's an election year, and you're going to have potentially the same or a new administration in January, and they will probably be looking to do maybe other things. Although the 340B is not important, it might not be the highest priority for some. So the idea that we can all kind of band together and work on this now I think is really what we've seen. So I'm just building on Bill's point that if you're waiting for the federal legislation to come riding in on that white horse, it might not be there. The horse might be in the barn still. So on that note, I'll close on that one. So Sophie, I think you said there was one more.
Yes, so what turnaround time would be likely or expected for a clearinghouse to get 340B eligible claims back to the CE?
Tim, I
Repeat it
think
one more time, back to the CE, is that what she said?
yes, that was the question.
Yes.
So maybe the question was, I guess, getting the data from the CE to the clearinghouse, maybe, if I reword that a little bit. So I think we'd adopt kind of industry standards around that, if that was the question. If not, please re-ask it again, whoever asked it. I think obviously 340B eligibility is retrospective in most cases. So I think we'd adopt kind of current standards, which I think are around, Carlo, 30 to 45 days. Is that about right? Or you can correct me on that. Yeah. But if I misunderstood your question, please comment in the chat window and we'll get it corrected.
There's two more questions in the chat. How do you determine which covered entities get to claim the claim? In other words, how do you eliminate multiple CEs claiming the same claim for an accumulation?
Yeah, this is interesting. I mean, this is not the kind of duplicate discount that we've been talking about, which is involving payers, but it does involve manufacturers. And that is when a pharmacy, and typically this would be a contract pharmacy, is filling a 340B eligible prescription, and the individual for whom the prescription was written can be claimed as a patient of two different covered entities. And so the TPAs for the two different covered entities are both qualifying the same prescription for replenishment. And so the manufacturer is getting two orders rather than one for a 340B replenishment drug. I mean, so the claims data all the 340B claims data is going to go to the clearinghouse, which would be RxParadigm. Would you be able to detect if two claims come in for the same prescription?
Yeah, that's something that was in our functionality. So that's something we could address. And as part of that, that discrepancy or that review at the front, we could cover that process. Yeah.
Oh, well, that's great, because I have to say, again, being up in Congress, this is an issue that's getting raised a lot by drug companies as another reason why the program needs to be reformed. So if we can solve this problem, that would really help. Now, then the question is, well, who gets the discount? Who gets the 340B discount? There'd have to be some agreement. I guess the simplest would be whoever claimed it first. Or you could look at it as, well, who had the most recent encounter with the patient? So, I mean, there's a lot of metrics you could apply to resolve which covered entity gets to claim that prescription. But it's great to know that you all can catch that right up front, because that will really help with protecting the program long term.
Absolutely.
Great. And Sophie, I think we might have time for that last one. I think there's about 5 minutes left on everybody's calendar here. So let's we can ask this last one, and then we can let everybody back to their work.
Does the Sustain Act or Access Act outline restrictions for contract pharmacies or open it back up to unlimited if a clearinghouse is used?
Well, the Sustain Act would. The Sustain Act has very strong language protecting covered entities, unlimited use of contract pharmacy arrangements. So, the Sustain Act may go through several iterations before it's eventually enacted, and that's assuming it is enacted. But if it is, I'm pretty sure that covered entities will end up having unrestricted use of contract pharmacies. Now, the same cannot be said for the 340B Access Act. I think in general, Health centers are protected because NAC is one of the partners in that, supporting that bill. But hospitals would not be. Hospitals would still be subject to restrictions and contract pharmacy arrangements. So, I mean, I think it's just another reason why no covered entity group, apart from NAC, is supporting the 340B Access Act.
Thanks, Bill. Well, I think that's about all the time we have, as they say. So I want to thank Bill and Tim for participating today and for weighing in on again, what we consider an extremely important topic. Thanks everybody again for carving out time. We greatly appreciate it. Again, our contact information is here. In case there's any outreach needed or follow-up, please reach out to any of us. And have a great day and have a great rest of your week. Thanks again.
Thank you, Carlo.